I'm Mark Olives, and this morning I'd like to talk to you about back pain. 90% of the population will have back pain at some point in their lives, and I'd like to help people to deal with this problem. But first we have to talk about anatomy so that you have a basic understanding of how your back works, because if you don't know how your back works, it'll be a lot harder to make sure that you overcome your current problem and prevent a future problem. So I've got my spine here, and I'd like to show you just a few things. So just for orientation's sake, this would be the back of your body, front of your body. If I turn this way, again, front of your body, back of your body, these would be the tops of your hips or your pelvis. From the back, this would be your tailbone. Right here, you can see, hopefully, there's nerves that exit in between each. Well, let's look at this segment. There should be a nerve coming out right here, and it's in between this bone and this bone. So at each level, there's nerves exiting. And then if we look at the back part, these are the joints. So you have a left and a right joint between each of the bones. In between here, you'll see what's called the spinal disc. And there's a disc in between each of the two bones. And I'm going to come back to this in a second. But first I'd like to just show you, if we look at the joints, if you bend your back backwards or extend, what happens is the joints, they all compress. If we bend forward, like we're going to touch our toes, then the joints all open up and I get pressure off of the joints. Also, if we look at what happens where the nerve comes out, when I flex forward, that nerve has a lot more room because there's a bigger space here. But if I bend backwards, the space is greatly compromised. Also from a standpoint of, a lot of people have spinal stenosis, and what that is there's a canal in here, or a circular opening in the vertebral bodies themselves, and the spinal cord goes down in there. Now if I bend backwards, essentially I'm decreasing the length of my spinal cord, and that's going to cause compression of the cord. But if I bend forward, what I'm doing is I'm stretching it out. So if you think about a piece of rubber tubing, if I squish it together, the diameter increases. If I pull it apart, the diameter decreases and becomes thinner. So with spinal stenosis conditions, when I bend backwards, I make that spinal cord shrink and it bulges out, and it's going to press in that canal. If I bend forward, it stretches the spinal cord out and relieves the symptoms. So I tell people that's an easy way to ascertain whether you've got spinal stenosis. If you bend backwards and it doesn't really do anything, spinal stenosis is probably not your big problem. Going back to the disc is probably most people, at least younger people's, biggest problem with back pain. As you get older, this structure starts to dehydrate, and then your problems become more likely to be coming from joints, from arthritis. Now this dehydration doesn't start until you're past about 50 years old. And then it's a slow process. So it's not like at 50 you can pretty much cut it out that I don't have any disc problems. But in general terms, if you're below 50, this seems to be a bigger problem than the joints. So I want to talk about the disc a little bit, because the disc is greatly misunderstood. I've frequently heard terms of slipped discs and that kind of concept, but the fact is the disc is actually connecting the bones of the spine. And I have another picture here that I want to show you. So from an anatomy book, you can see that this is the disc. It's actually connective tissue that joins this bone to this bone, and it's kind of aligned on a diagonal pattern. And there's like 7 layers, like an onion, and they're oriented on different planes that are again connecting these two. So the idea of this entity, this disc, being able to slip out is completely preposterous. That can't happen. You'd have to disassociate the entire spinal cord, which would result in paralysis, but most likely death. So it's just not going to happen. What's going to happen most likely is you'll get pressure on this structure, and that's going to cause it to bulge. Now the only place they've ever been able to demonstrate a disc bulge is in the back of the disc. This is unfortunately the weakest part of the disc and the most likely to get harmed. And the worst thing we can possibly do to put pressure on this part of the disc is we compress say by bending forward, we compress the front part of the disc, which then causes the fluid that's inside here to migrate back. Now, inside of the disc, there is a fluid. You can think of it, it's a little thicker than water, not as thick as molasses, somewhere in between there. But it is fairly viscous, and it's got to pass through a network of fibers. So you can think of it as trying to push like a molasses through a strainer, but it's strainer after strainer. So it takes about an hour for the disc material to move from front to back. Now, once you've got pressure on the back part of this disc, you're highly vulnerable, because now you've got all this pressure sitting on the back part of the disc, and also if you were flexed or bent forward, you've also caused this back part of the disc to open up or stretch. So now you've got an elongated tissue with a lot of pressure against it. And that's frequently how you're going to cause a lot of back problems. So bending the disc forward creates problems. Bending it backwards, however, helps compress the back, moves the disc material forward, where you're much safer. So that's generally how the disc works. And in another video, I'm going to give you some greater detail on the disc and how it actually functions, so that you can, number one, help prevent a future disc injury, and then number two, just basically understand the things that you might be doing in your life that are causing you to have problems. So I'll talk to you soon about that. Thanks.